Hello, welcome everybody. This is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine. I am here to help you with all the information you need for your heart health and medical health, and informing you about all the latest treatments in cardiology and medicine. If you are new to this channel and would like to take great care of your heart, then definitely consider hitting the subscribe button below so that you don't miss any up-to-date information that emerges in the cardiology and medical fields. Today, I will be talking to you about the main causes of chest pain. According to the United States Center for Disease Control, chest pain accounts for more than 7.6 million visits every year to the emergency rooms, making chest pain the second most common complaint after stomach and abdominal pain. In this video, I will focus on the main causes of chest pain that the emergency room physician would go through for anyone presenting with it. The life-threatening causes will need to be considered first. The top 6 life-threatening causes are: 1. Angina and heart attacks. Coronary heart disease remains the leading killer of adults in developed countries. About 15 to 30% of patients presenting to the emergency rooms have either angina or a heart attack. As shown in the illustration, patients will present with either chest pain or discomfort, lightheadedness, nausea, vomiting, jaw and neck pain or back pain, discomfort or pain in the arms and shoulders, or shortness of breath. Number 2, a tear in the inner layer of the aorta, the large blood vessel branching of the heart. This is known medically as aortic dissection. This commonly affects patients with high blood pressure in their 7th decade of life, but it can affect younger individuals, particularly those with non-aortic valve or connective tissue disease. Most patients with dissection will need open heart surgery. Number 3, clots in the artery delivering blood to the lungs. This is medically known as pulmonary embolism. Early diagnosis and treatment significantly reduce deaths from this condition. Pulmonary embolism occurs when a dislodged clot, usually from the leg, passes through the right side of the heart and becomes lodged in the pulmonary artery, the main artery that delivers blood to the lungs. This will block delivery of blood to the lungs and the heart. Number 4, lung collapse caused by air leaking into the pleura, which is the space between the lung and the chest wall. This is known as pneumothorax and is shown on the X-ray. You might appreciate that on the right side of the screen, part of the lung field is clear due to collapsed lung field. Pneumothorax can occur following injury or lung procedures. It can also occur spontaneously in patients without underlying lung disease. The accumulation of air in the pleural space can lead to compression of the heart and the large arteries, leading to rapid clinical deterioration and death if untreated. Number 5, inflammation of the chest area between the lungs in an area that contains the heart, large blood vessels, the trachea, and the esophagus. This inflammatory condition is known as mediastinitis. Death for patients with mediastinitis is high if not diagnosed and treated early. Number 6, compression of the heart due to accumulation of blood or fluid in the space between the heart muscle and the outer covering sac of the heart. This condition is known as pericardial tamponade. As you can see, the heart on the left side of the screen is normal and the heart on the right side of the screen is compressed by the fluid, and this impairs its function. This condition has to be diagnosed and treated early in order to avoid death. There are other common chest pain causes that are not immediately life-threatening, and I will divide them according to the organs involved. Heart causes include acute heart failure, valvular heart disease, inflammation of the heart lining, medically known as pericarditis, or inflammation of the muscle of the heart, medically known as myocarditis. Lung causes. These include infections such as pneumonia or inflammation of the lining of the lung, medically known as pleurisy. Gastrointestinal causes, such as gastroesophageal reflux, when acid from the stomach flows back into the esophagus, which is the tube connecting your mouth and stomach. This backwash of stomach acid irritates the lining of the esophagus, leading to chest pain. Another gastrointestinal cause is hiatus hernia, which occurs when the upper part of the stomach bulges through the diaphragm, which is the large muscle separating the abdomen and the chest. Musculoskeletal causes. This includes pain from the ribs, from fractures or muscle strains, or inflammation of the cartilage of the chest wall. Panic attacks. This can also lead to chest pain. As you heard so far, there are many causes of chest pain, and it is crucial to differentiate the life-threatening causes from the non-life-threatening causes. If you get chest pain and the pain is persistent, then please report immediately to the nearest emergency room to get checked and treated. If you have any question about what I presented to you today, or any cardiology question in general, then subscribe to my channel and share your question in the comment section below, and I will reply to you. If you have a question that you would not like to share in public, then subscribe to this channel and follow me on Twitter at Dr. Bolad, and then send me a direct private Twitter message and I will reply to you. This is Dr. Bolad, helping you with your heart health and general health. Thanks for watching, and talk to you soon.